of your questions as we can. You know, we've been working with a team of local health experts to get you the facts and not spread fear. You can send us your questions anytime by texting 503-226-5111. You know, we are in this thing with you, and we're committed to answering your questions every night here at 7 o'clock. You know, we really couldn't do this show without experts like Dr. Claire Wheeler. Dr. Wheeler is with OHSU and the PSU School of Public Health. She joins us live tonight to answer your questions. Dr. Wheeler, I interviewed you 2 weeks ago, back when we still had guests coming to KGW. I mean, that feels like a lifetime ago, doesn't it?
Yes, it really does, and I'm so happy to be doing this remotely.
Yes, we are so glad that you could join us. So let's get right to some viewer questions. So the first one, let's talk about self-quarantine. So when should you self-quarantine? Is it when you feel sick, or is that something that a doctor needs to tell you to do?
If you feel sick, you should be quarantining. At this point, it makes sense if you start to get symptoms. And of course, many of us know the most common symptoms of COVID-19 are a dry cough, but it can be productive. Fever and aches. You could have a sore throat, and there have even been reports of some gastrointestinal symptoms as well. Anyone with symptoms should call, not go, to the doctor or OHSU's telemedicine line and get their recommendations, and they will probably be told to self-quarantine. That will be the answer. In my opinion, almost everybody should be self-quarantining at this point, and I know that sounds a little extreme, but that's what a lot of people are calling for.
Okay, great information. So I have my wipe here. I think everyone, you know, has wipes or hand sanitizer, because there's a lot of information out there about how long the virus lives on surfaces. What can you tell us about that?
Yeah, that is such a great question. And, you know, I had some information from some studies that have been done previously with human coronaviruses. But just yesterday in the New England Journal of Medicine, a study was published where they actually tested this particular COVID-19. And so the numbers are a little bit different from a human coronavirus. Plastic and stainless steel, 72 hours. Copper, about 4 hours, and cardboard, 24 hours. And that probably has some impact on the safety of packaging and mail that I think someone was asking about also. But I also wanted to make sure I mentioned, in that study, they looked at aerosols as well. And there's been some concern about whether or not this virus can be transmitted through aerosol, you know, just people breathing and being in a room, and then you inhale that air and possibly get it. In this study that came out yesterday, aerosols were viable for about 3 hours.
Wow.
But at the same time, other studies have not found any virus in the air of rooms with patients. So at this point, we're being extra cautious and looking at aerosol transmission, but it seems to be pretty low.
So when you say aerosol, I mean, what about airborne? So for weeks, we heard the virus was not airborne, but like you said, there's all this new research coming out. So what should people know about that?
Yeah, aerosol and airborne are essentially the same thing. Aerosol is just what comes out of your mouth when you breathe or speak. So you don't even have to be coughing or sneezing to release aerosols. That's just part of breathing. And so an airborne transmission means that as people are just going around their daily lives breathing, that with every exhale, the water droplets in your breath are carrying tiny virus particles that someone else could breathe in, or they'll fall and settle on a surface. Fortunately, this virus so far, like I said, doesn't seem to be it doesn't hang in the air that long or stay alive in the air that long. But right now, with these mixed results, we can't be sure.
Right. And so it is so beautiful outside right now. I mean, and I know we saw the sun all day, and hopefully we'll be seeing the sun all week. Is it safe, with that information you just told us, is it safe to be outside, to bring your kids outside?
You know, I am a Portlander like all of us, right? And when it's sunny, all I want to do is go outside. People who are symptomatic should not go outside. People who are asymptomatic, I think, it's my opinion, just based on everything that I've seen in the research so far, that it's probably fine to stay in your yard, on your porch or your deck is even better. But if there are if you live in a heavily, populated area, where there are going to be a lot of people going by, it may not be the wisest thing right now to go outside, at least until we know this virus better.
Okay. So like trails, empty trails, would that make you nervous?
Well, there's no guarantee that they're going to stay empty.
Right.
That's the problem. And you know, I live right on the edge of Forest Park, and I haven't been there for a couple of days, and I understand there are still people hiking there. It's probably safe. It's probably fine, but we don't know for sure. And so
Right.
if there is any risk, if you're older, you have little kids at home, etc., maybe just wait a few days and see how things have changed.
Yeah, why risk it? Okay, let's talk about testing.
Exactly.
Yeah, let's talk about testing now. A viewer asks, you know, why is one of the criteria for getting the test? Why does it have anything to do with travel, especially since so many of the cases of people that have it did not travel?
Yeah, right. We are definitely in the phase now of what is called community transmission, which means that we have no idea where, we can't track back, say, to patient zero here in the U.S. who got off a plane somewhere, at least for the whole nation. And the reason why the emphasis is still on testing travelers is that we have the highest chances of catching cases that way, because we know, that the likelihood of that person carrying the virus is going to be higher than someone who didn't travel to one of these hot spots. That said, the only reason really why we should be doing that now is because we have a limited number of test kits. If we had enough, and hopefully someday soon we will have enough, everybody should be tested. But right now we have to prioritize populations where we're going to get the biggest return on our investment.
Okay, Dr. Wheeler, thank you so much again for joining us, but I don't want to let you had one important thing that you wanted to say to viewers, and what was that?
Well, I have many friends who are actually still practicing physicians. I'm not currently in practice, so I consider this as, me doing my bit, sharing this information. But all of my friends who are physicians, when I talk to them about these interviews and information, all they have to say to people is stay home. Please stay home. Even if you're not in quarantine and you're not in a lockdown area like the Bay Area in California, just, stay home and minimize the odds that you or someone that you come in contact with will get infected. Hospitals in New York and Texas and Seattle are already at capacity. That means no one else can be given the type of care that they may need. And in fact, one physician at the University of Washington who died of the virus just today or yesterday. Healthcare workers are really at the highest risk of all. And the best thing that we can do to help them do their jobs is to minimize the number of people that they need to take care of.
All right, Dr. Wheeler, I'm sure we'll be checking in with you as this continues. Thank you so much again.
Oh, it's my pleasure. Thank you so much, and stay safe.
We will. All right, so I'd say the number one question out there from all of us really, when will Oregon be getting more tests for COVID-19? For that answer, we turn to reporter Kyla Boshi, who's been working on that story all day.
The governor has indicated that testing will ramp up here in the state within the next week or so, and we've already started to see evidence of that even today. The state announced it's reached an agreement with a private lab to conduct some 20,000 tests. 5,000 of those tests should be ready here very soon. Additionally, Providence said it'll begin testing 500 to 600 people a day. Keep in mind, that's not open to the general public, though. That's a referral from a doctor. In addition to the private providers, testing will also be coming from the government, the federal government. The feds have announced 1 million tests will be distributed nationwide this week. That'll increase to 5 million over the next 3 weeks, but it's not clear how many of those tests will be allocated to Oregon.
All right, when we come back, you probably don't want to look at your 401k right now, but I talked to a business expert about the chances of a recession and what you can do to protect your money. But first, a quick answer for a viewer who wanted to know which stores were opening early for seniors. Here's a list for you. To say most of us are worried about our finances right now is an understatement. I had the chance to talk to Stephanie Ruhl earlier, and if you've been watching NBC News at all, I'm sure you've seen her. She's their business correspondent, and she knows her stuff. I got a chance to ask her all of your market-related questions. Stephanie, prominent hedge fund manager Bill Ackman told CNBC today, hell is coming. Do you have that same belief?
Remember, Bill Ackman is an investor. Bill Ackman is a huge shareholder in Hilton. What Bill Ackman is talking about, which is what we've heard from a lot of investors who are actually less focused on the markets, and they're really looking at this as a public health crisis. Bill Ackman is calling for the globe to shut down and stay home for 30 days to really ward off the spread of the coronavirus. He's not the only one who thinks that. He's concerned that we're not taking this seriously. I know where you guys are, you're seeing more people take this seriously and stay home and protect themselves and their community. But Bill Ackman is looking at pictures from Miami, Florida, where people are still on spring break, where they're crowding beaches. So when you talk to investors who look at the global economy and think about the supply chain, think about countries this hasn't even hit yet that are emerging markets, that are developing economies. And we say, oh, can we handle this? Can Italy? We've got we have the strongest economy in the world. Imagine what this is going to be like when it hits smaller economies. So Bill Ackman might be being a little bit alarmist, but he is someone with a vested interest in a lot of these businesses that he thinks could be going to zero. So it's definitely something to be at least somewhat afraid of.
All right, let's talk about the stimulus plan. So the president pushing a big stimulus plan, over $1 trillion, most of which will go directly to people's pockets. You know, will that keep the country from a recession?
No, we are going to head into a recession because look what's happening. We're basically putting our entire economy in shutdown for a period of time. That cash payment isn't going to get us out of that. Just like interest rates dropping doesn't mean you're going to go out and buy a house or a car or plan a trip to Disney World. All of this is to just keep people solvent. So that cash payment, just think about this. Imagine if you had a shift job or a job where you needed to get tips. Well, right now, if you weren't feeling that well or you had a kid at home, you might go to work even though you should quarantine or isolate yourself. Well, if you got that cash cushion, it might help you make a better health decision and a better financial decision.
That makes sense. All right, small businesses here in Oregon and Southwest Washington are laying off employees, sadly. You know, what can they do to help themselves and their employees?
Listen, it's a really hard time. It's an important time to care about one another. So for landlords of small businesses, if they can give their occupants a little more grace period, maybe not demand that rent payment right away, that would help. If you in your community know that there are restaurant workers who have been laid off, if you can help them in any way, that would be a positive. But for businesses who are just reducing the hours of their employees, it's better to help your employees understand what unemployment benefits are out there. Now with the government stimulus program, what sick leave is out there. So people might have their kids at home they have to take care of. And in a city and a state like where you are, I know that local governments are paying a whole lot of attention to this. Remember, no company, no individual did this. It's like a natural disaster. And the sooner we can work together to solve for it, the sooner we're going to get to the other side. Remember, just a few weeks ago, things were okay economically. What this is a necessary shutdown to address a health crisis. And if we can do that, then we can find our way back to a healthy economic picture.
Okay, and then last question for you, Stephanie. Is this a time that people can take advantage of the lower interest rates, you know, make changes to loans or mortgages, or is that the wrong move?
It's definitely worth looking into. It's not a guarantee that you'll get it, and I assure you there is an influx of requests to mortgage banks out there for people who are looking to refinance their homes. And just because you see rates get close to zero doesn't mean suddenly your mortgage will get there, but there's a decent shot it might go down if you've got pretty good credit. It's definitely worth looking into at a time like this.
Thank you so much. This is a scary time. It's an uncertain time. Yeah, but people like you really break it down and just make it easy to understand.
Can I make one more recommendation?
Of course.
Take a deep breath. The more we can just take a deep breath, we don't have to solve everything in one day. We got to just get through the day.
Great advice. Thank you so much again. All right, more of our special Q&A show up after the break. But first, here's a quick question a viewer asked. I have heard both 3 feet and 6 feet is recommended social distancing. Which is correct? Your best bet is 6 feet. The virus is transmitted through droplets when someone coughs or sneezes, and those droplets can travel anywhere from 3 to 6 feet. You know, we've told you that schools have been ordered to stay closed until April 28th. Some are asking, how in the world can daycares remain open then? Here's what the governor said in an answer to that today.
Right now, we need to make sure our healthcare providers and first responders can do their jobs. Providing childcare is a critical way to support them. Every state governor that I talk to understands that they have to do this in order to support our healthcare system.
All right, so our first coronavirus-related question has to do with your taxes. The person asked, has Oregon issued a tax deadline extension? So according to the Oregon Department of Revenue, if you file for an extension, you will automatically be granted one. That's for your state taxes. In terms of federal taxes, the IRS announced that you still have to file by April 15th, but you have an extra 3 months to pay if you owe. Our next question, are food cart pods still safe during this time? I asked Dr. Kim Taves about this with Multnomah County Health. She said, okay, they're still open because you can get it to go. You can get the food to go. And she said, you know, order your food. Don't stand in a group while you wait for it. And don't sit at a picnic table with a bunch of strangers after you get your food. So really just get your food and get out of there. You don't want to be around crowds. Next, are teachers being paid while school is closed? Yes, we can tell you that teachers are being paid, regular employees are being paid, and that was according to Governor Kate Brown's order. And our next question, should I still schedule play dates? So we've been hearing this a lot. You know, kids are home, parents are home, you know, kids obviously want to go and play with their friends. The experts at first, they were saying, you know, maybe you want to go with one other family and have an agreement that you're not around other people. But now experts are saying, every doctor I talked to are saying, no, it's too risky. You do not want to schedule play dates at this time. We love answering your questions. Please keep sending them in. Every night, 7 to 7:30, we'll be answering your questions. All right, we've got time for one more question. A viewer tells us she's worried about the vegetables she buys at the grocery store, even those in packages. So we talked to a microbiology expert about this who says while many surfaces can carry the virus, your groceries compared to, say, a public doorknob are low risk.
Most likely it was handled just once or twice by the person, and these days the person probably is wearing the gloves. So the level of the viruses to an infectious state would be a lot less.
All right, great advice. So we want to thank you for sending in your questions. We've gotten hundreds of them on social media, through email. We are reading all of them. We are doing our very best to answer them and working with such a smart group of people to answer them. Our past stories may help answer some of your questions. Go to the website on your screen. See you tomorrow at 7.
The season of renewal is just around the corner. Are you ready for a spring refresh? Then hurry in to Dania Furniture for the